There's event next week, right, Camille?
Yep.
So almost the final event of the year. I hope everyone's doing well. Do you want to move to the next slide? Just checking in on our staff. We've had some folks leave over the past couple of months. Cassie went to Oxford for a master's degree, and Olivia is doing great advocacy work now at the National Low Income Housing Coalition. So Sonia, who many of you have met from the other webinars, has joined our team, and Alex has been helping with the helping with a bunch of the administrative stuff and helping to run of our systems. And I forget if I didn't look. Today is this week was Leah's first week back from maternity leave, which we did forget to get a cute baby picture. I meant to add that in, but so she is coming back and available too. So just welcome to all. You'll see these names as people reach out to you for questions and requests. So Camille is always thoughtful and thought I should take a moment just to congratulate all of us for making it almost through 2020 and to really thank you for everything you've done for your own communities and for the network over the year. And we've been just so proud to see how responsive and resilient and flexible all the partners have been, despite serious disruption to both personal and professional lives. I know with many of you homeschooling or taking care of little kids. And we weren't sure how things were gonna go, but despite the uncertainty and all the stress you were under, partners really came together in exciting ways to share strategies and help each other and commiserate, and everyone has been really generous with their time. So we appreciate your patience with us as we are still on the learning curve with virtual engagement and trying to make the best of that and try to pivot our content, but want as much feedback as you're willing to give, good and bad, about how the year went as we work to plan 2021, which will hopefully have fewer crises. So we're really grateful for the community we've built together. It would have been a much harder year without all of you to lean on. Do you want to move to the next slide? So special thanks to the executive committee, who were really critical in helping us pivot. When we first started to talk about what to do on the NNIP meeting, they just flat out rejected our first idea, which was fabulous. So we would have made a lot of missteps, a lot more missteps without them. So that's Katie Pritchard.
Kathy, you muted yourself.
Kathy, I think that was me. Sorry, I was letting people in from the waiting room. So unmute yourself and
unmute. Okay, good.
Yes.
So Katie Pritchard, Caroline Bala, John Colleen, Jay Wu, and our two departing members, Noah Urban and John Cruz. And every year I think I won't be able to survive without the people who are leaving. And then there's more amazing people that we get to know. So there's 3 candidates for the executive committee. You can see here, we have the business list, that people who get the more of the administrative or funding sort of notes. So notes went out to that list. If you want to be on it and you're not, let us know. But we do really aim for 100% turnout, which we've gotten for the past few years. So thanks, we have 7 votes so far. Your vote really matters. These are often close, very close elections. And we're totally willing to do a hand recount if anybody wants to question the results afterwards. Good. So this is also a time when we take a moment just to highlight some of the content and things we've finished over the past year. We did a whole package of work called Elevate Data for Equity, funded by the Robert Wood Johnson Foundation, that wrapped up in August. There is Principles of Equitable Data Practice brief that's meant for data analysts and all of us, and including something that we really use to reflect on. There's a brief that we hope all of you will use on that's aimed at philanthropy, giving them arguments about why they should invest in local data capacity, i.e. invest in you all. There's stories for many people on the call here from Milwaukee and Houston and others about local capacity investments. We have we made a pretty handout of what community data, what it takes, as Laura McKernan would say, what it takes to be good at data for a community, and then resource links. So we hope that you'll take a look at those things, and they were written with all of you in mind. Next. There were also a bunch of different stories. The Houston one came out of the Elevate work. Oakland was our winner this year on the Impact Award, but also some great stories about Atlanta and United Way and their partnership with United Way, which I get a lot of questions about, and some Baltimore work on the capital investment. So we encourage you to check those out, but we're always looking for new stories. These are like, 500-600 words, and it doesn't have to be like a major, like the law changed. It could be that you're helping to guide some foundation's investments, or you helped a neighborhood group advocate to the city council, sort of any sort of large and small impact that we want to highlight. Next. So a lot of our time has been diverted this year in unexpected ways, and two of them has been these rapid response grants. And hopefully I didn't leave anyone off. I just did that by memory on the list of the partners who were either direct grantees or partners with grantees involved from the Robert Wood Johnson Foundation. And then there's 3 from the Casey Foundation that are really youth focused. And we're excited to see how those progress are being made. And we have this beautiful new blog. I should have made a snapshot of it. On the Medium page, Sonia is the mastermind of it. As many of you know, our website is terrible. Our NNIP website is terrible and not really suited for good modern communications. So this Medium page gives us a platform, and it is really intended to not just be these grants, but also cover all of NNIP. So we have an illustrator on board to help with the images, and we're very excited about it. So you'll be seeing more of those. Thank you to Seattle, Austin, and who else am I forgetting? Camille? The 2-in-1 folks. Boston, Seattle, yes, Boston, that helped us with our latest one that's coming out next week on 2-on-1, and we have one on small businesses coming out later this afternoon. So we'll be publicizing this over the next few months, and hope you'll help us to do that too.
Giving you a quick screen view of
there we go.
The Medium blog.
And Camille did this great one on youth, engaging youth in research, and we hope that that's much more of a common practice too, with the guidance from the folks that are working on it now. Next. So I don't know if any Pittsburgh folks are on the webinar right now, but Civic Switchboard is a project funded by the Institute for Museum and Library Studies that's been going on for the last couple of years. The latest grantees, you can see this really cool work Durham's doing on racial covenants and really digging out old historic records. And so data and drafts, I know which would appeal to many NNIP partners, combining many favorite things about civic data and doing COVID updates and things like that. I just sat in on one a couple of weeks ago that was really great. This is about promoting both academic and public libraries to get involved in the community data ecosystem. And they just got a new grant I just learned to have community data information curriculum to develop a curriculum for the library science degrees too. So hopefully train even more librarians to work with all of your data. So if you aren't working with your library, there's a great guide they've written, and I encourage you to reach out. They've been a great resource to lots of partners. I'm going to turn it over to you. I'm right on time, Camille, for the first time ever. Maybe we'll end 2020 in a good way.
You sure are. So we also wanted to give everybody a snapshot of what we're going to be working on moving forward into 2021. We've had a couple of conversations within the NNIP network, and we've received feedback from you all. So our plan, we thought, start in the new year. Nobody wants more content at the end of this year. But we're going to start with a few peer discussion sessions. The ones we currently have brainstormed are around racial equity work in the university context. We know for some of you all who work at universities, it's an interesting game to navigate the university policies with advancing the work that you all are doing with communities. So we're going to bring together people around that particular concept to discuss as well. We're going to have some of our partners talk about building new partnerships within their community, what those steps look like to kind of generate ideas for reaching out to new partners, maybe identifying partners that you wouldn't traditionally think of to include, and methods for partner engagement. And then finally, talking about data lifecycle and racial equity in the different steps of our work. So really breaking that apart and thinking about particularly the stories that we communicate with our data. We are also at our planning for our last in-person conference, which got canceled, we had a equity and algorithms presentation planned that we were working on with a fantastic external presenter who we are working to engage again coming up in the new year. So we'll have an external presenter come to speak with us, particularly about equity and algorithms. Kathy, do you want to give more about the presenter real quick? You're on mute.
A woman from the NAACP who has been doing community organizing on a large scale in New York City. So we will keep you posted. I think if she doesn't work out, we'll look for somebody else. It is a particular interest of the Casey Foundation also, who just came out with principles on for data analytics. Sonia, if you could Google that. So that Chris Kingsley is excited to have that panel.
Then finally, this is something we're feeling out to see how much interest it is. We've been talking about doing small group meetings that might meet on a regular basis that we've been referring to as accountability groups, but they'd really be kind of learning networks where maybe everybody who's a part of the network is setting a goal that they come together regularly for feedback, individual goals, but they come together for feedback and to kind of discuss the challenges that they're facing and some of the nuances that might be coming up for them. So we're really interested to see how many people are interested in being involved with that. So please let us know if you would be interested. That was a lot of interesteds, but we're gonna keep moving.
We'll send more information out to get feedback by email too.
And then also our plans for virtual engagement moving forward. Again, we'd love to hear from you all about what you're interested in having in the new year. We'll certainly continue topical discussions. We've had particular webinars about evictions during COVID and other COVID specific topics this year. We also plan on doing kind of birds of a feather conversations. So we'd like to hear more from people about what conversations they'd be interested in having with people who are similar. The university racial equity webinar is kind of coming out of that idea as well. We'll continue our idea showcases like this one. And we're thinking about piloting some new formats, including coffee hour with Kathy and Leah, which can be kind of just a drop-in chat, ask questions that people could kind of come together informally. We also have tried, we did a happy hour, and so we want to revisit that again as kind of some social hours or cross-site project development groups using some new software. We took a look at GatherTown, so we're exploring that. And then we're always interested in hearing what you all think about alternatives to a spring meeting, since we should probably expect to be virtual for a little while longer. Kathy, is there anything you wanted to add there before we move into presentations?
Nope, I think, yeah, just keep giving us, we've been trying to balance all year, keeping people connected and also not being burdensome when people are Zoom fatigued. So it's been, we've been trying to thread that needle throughout the year. So feedback on what's helpful and what's to your own work, or if there's other pieces. This is also, we know there's lots of engagement, like one-on-one partners calling each other. So I encourage you to do that without going through us too. That's as other ways to keep ties to the network. I think we're particularly concerned about new people. If you are new to the network, for many of us who have known each other for a while, it's been easier to keep in touch. But for either if you have newer staff coming into NNIP, or if you yourself are new to NNIP, ideas about how to make you most welcome and let you jump in would be great.
An open offer for particularly new people. You don't need to have a particular question or issue to talk about, but you can always reach out to me. I'm happy to have a social hour to get to know new people in the network. And then the Emerging Leaders Conference, Camille can send a reminder note about that, which the last Emerging Leaders event is next week. On the 10th. On the 10th. I've been politely staying away from those, so not give people their space. All right. So we are going to move to our showcases today. We're going to kick it off with Amy Carroll-Scott from Urban Health Collaborative in Philadelphia. Do you want to share your screen? Is that the best way?
Yeah, that'd be great, Camille.
Okay.
Okay, and I'm going to be co-presenting with my colleague, Danny. Danny, are you unmuted when you need to be?
Ready and able.
All right, let's get started. We did a showcase back in May about our Urban Health Collaborative response to the pandemic, and also some of the work we were doing through West Philly Promise Neighborhood. One of those was a dashboard that we had just gotten funding for. So we wanted to come back today and talk to you about what we've built. Oh, I also should mention colleague Phyllis Resnick is also on the Zoom. To give a background, we wanted to create a COVID dash to provide contextual information for COVID tracking, not to do COVID tracking, which is being done by the Philly Department of Public Health quite well, but to provide the context to be able to inform COVID relief and recovery efforts and limited resources and resource allocation, to provide communities with their own access to data for advocacy and funding. And so we got a rapid fund through a grant through Drexel, and we were able to leverage all our West Philly Promise Neighborhood indicator work that we had been long doing through that grant. So I don't need to go through this, but I wanted to let you know that we're sort of orienting this around a shared idea of what it means to be vulnerable, which means not just less access to resources and more vulnerability to the disease and its social and economic impacts, but that it's the result of historic and systemic inequities, including racism and classism. And so we include that in all of our promotion of the dashboard. So the dashboard is based on the Social Vulnerability Index created by the CDC for the purposes of disaster preparedness and response. And we just tweaked it to be relevant to urban areas, especially Philly, and for COVID. We wanted to make sure that we identified for this indicators that were publicly available citywide. And you can see the data sources here. Danny?
All right. Oh man, I love the challenge of 5-minute presentation because I love lots of information at hyper speed. So I'm super into this. So I'll talk through the 3 different sets of dashboards that we have. The first one uses the indicators from the CDC Social Vulnerability Index, which you can see listed on the right. The way that the dashboard is laid out, it has a map. In the purple boxes up top, you can see you can select the indicator and whether you want to look at percent or count. Then I think one interesting piece for everybody is that in the orange boxes, you're able to look by the planning district or by neighborhood. Although the data is at the census tract level, we wanted people and organizations to be able to look at the neighborhoods that they work in and are interested in. So in GIS, we put the census tracts on top of the neighborhoods and assigned every census tract neighborhood, or created multiple rows for census tracts that overlap multiple neighborhoods so people could identify where exactly they want to look at. Our second set of dashboards, we added additional vulnerabilities for COVID-19. You can see the indicators listed there on the right. And so on the dashboard, when you hover over a census tract, you get the information about what neighborhood, what census tract, percent, and count. Next slide. And then we also have data about essential workers or people working in essential industries. This is coming from the public use microdata sample, which now you can create all your own crosstabs, so it's incredible. So we have data about industry and pay broken down by race and ethnicity, because the way that the data is organized, yes, the health data is from 500 cities. The way that the data is organized is that essential industries include lots and lots of different types of occupations. So people who work in food service industry can include people who actually work in restaurants, as well as people who are able to continue working from home, executives, lawyers, people working in sales. So we wanted to try and figure out a way to let people know who could be at a higher risk and be continuing to go outside of the home to work. And we know that lower paid employees are more likely to be frontline workers still working outside the home at higher risk for COVID-19. So at the bottom, you can see we broke down the pay into 3 different categories, and we were able to show data for Black and white workers.
Great. So we have a pretty robust dissemination plan through all of our Promise Neighborhood and city partners. We consider this tool a first step in our partnership and their use of it for their decision-making and advocacy. And then we started with beta testing with community leaders. It's on our UHC website. It's actually driven a lot of traffic to this and to other parts of our work. And we've promoted it with all the different kinds of users you can imagine using things like this 2-page flyer. And then on request and by design, we do one-on-one and group demos. And then lastly, just want to say that we're working with our city partners to identify and include real-time data to show the impacts of COVID. So this, because of the availability, is showing vulnerability to COVID using pre-COVID data. So we're working with various city partners from various agencies to be able to identify and develop data use agreements for data that can show the impacts of COVID through the spikes and through the restrictions as we go through these different cycles. We're also expanding our housing and behavioral health indicators for the new dashboard we're doing with Philly List through that RWJ grant, which was mentioned earlier. And we are developing a violence dashboard, especially because of our upticks in community violence and in police violence since COVID. And so we're working with our community violence working group at UHC for that as well. It's been used in a lot of various ways, so we'd love to talk about that either today or at other times, but please contact us. And also we have lots of questions for those of you doing dashboards if there's time for discussion. That's it.
Great, thank you so much. My plan at the moment is to have us do a discussion after all 4 presentations. So I wrote down my questions. If people have questions for that presentation, you can also enter them into the chat and we can revisit them as we go to the discussion at the end. So we have next up from our friends at the Colorado Futures Center, we have Phyllis Resnick. Phyllis, do you want to go ahead and share your screen?
Sure, I can do that.
Great. Let me know if you need any help. Great, looks good.
Where we go, here we go. So let me put it on slideshow. So thank you for letting me join. For those of you who don't know me, you probably know Jennifer Newcomer, who at the time you worked with her most, she was at the Pettit Foundation. Jen and I have been colleagues and actually friends for many years. And I was delighted back in April that she decided to join the Colorado Future Center. We had been collaborating, and I met some of you at an NNIP meeting in Los Angeles a couple of years ago. But Jen and I have been collaborating for many years, and we finally decided to consolidate a portfolio under the Future Center. And so this work that I'm going to share with you today has not been formally released yet. It's a project that Jen brought with her from Pettit to the Future Center, and it is funded largely by the Colorado Trust in Colorado. And our role in it is to be part of a greater project that they're calling the Colorado Equity Compass. And we were tasked with demonstrating the relationship between social determinants of health and health outcomes in Colorado, with three essentially goals that the trust created. The first was to change hearts and minds about the importance of social determinants. The second one was to accommodate small geographies. In this case, we're using census tracts. And the third was to incorporate a racial equity perspective. And those three have proved to be a challenge, because when you want to accommodate all three of those, there might be data you want to use, but it's not available at small geographies, or what's available at small geographies isn't available cut by racial and ethnic. So what I'm going to share with you is sort of what we were able to put together. We had to do a little bit of triangulation. I have some high-level findings, and then I'll talk to you just briefly at the very end about where this is going. So the two measures of health outcomes we were asked to use by our partners at the Trust. We gave them an option of about 6 or 7, and they selected the first one being life expectancy at the census tract level from the USA LEAP program. Those are 2015 data. They have not done an update, unfortunately. And the second is the self-reported health status data on the survey question from the behavioral risk factor surveillance system data. The important highlight here is neither one of these is available stratified by racial and ethnic, because at that small geography, there just wasn't enough data to do that. So that's going to be important in a moment. On the what I would call the independent variable side, we again had to whittle down our list of social determinants, because many of them we could not find data for at the small geography level, but this is the list that we eventually settled on. And when you see the full project come out, you'll see that we also further group them into categories that, in the interest of keeping the 5 minutes, I'm not going to share those data, but we certainly have a lot of sort of what's below this. What we did with these at the high level is, I keep moving my picture of folks. In fact, I think I'll minimize it. What we did with these at the high level was we created an overall index of social determinants. And so you can see on the left-hand panel here is the histogram of that index, pretty much centered on 0, which is the state mean. And then you see that we have some census tracts, which are essentially represented by that frequency vertical axis that perform fairly high above the mean. And of course, you know, as you would imagine, some that perform below. And what we looked at first, and I will admit to holding my breath as I ran these, is hopefully that index of social determinants is positively related to health outcomes. Because if we want to change hearts and minds, we need to be able to demonstrate that the stronger your census tract performs on social determinants, the higher both the self-reported health status, again, that's a self-reported measure from people who are taking a survey, and the higher life expectancy is in that census tract. In these graphics, each one of these little blue dots represents a census tract in Colorado, and then you see the essentially regression line relationship, thankfully positive. But then we were also tasked with putting a racial ethnic overlay on this. And so, of course, the easiest way to do that would have been to have the data stratified by racial and ethnic. But unfortunately, as I mentioned, the dependent variable, the health status variable, and the life expectancy variable were unavailable with that level of detail. So we had to do a little triangulation. And so what we did was, we then ran the relationship between the percent of color in each one of those census tracts and that index of social determinants. And I will not say I was hoping it would come out negative for any reason other than we want to make the point that when you put the racial overlay on this, that we have some work to do. But I will say I was actually not surprised that we get this negative relationship. So while we know now that social determinants are positively related to health outcomes, we've also demonstrated that social determinants essentially are negative related to the percent of color in each one of the census tracts in Colorado. So the higher the percent of color, the less essentially rich in that basket of social determinants the census tract is. And then of course, the third piece of the triangle then is to try and come back to establishing some relationship with life expectancy. And so when we run those social determinants index against percent of color, we also get, or I'm sorry, when we run the health outcomes against percent of color, we also get the relationship that the higher the percent of color in the census tract, the lower both the self-reported health status and the life expectancy, sort of the more scientifically measured outcome, if you wish. So sort of going back, when this is fully deployed, the website will start with this high level story. It'll start with, trying to convince folks that social determinants are important. We'll use, something not this probably geeky and data driven, but, we'll do it more with stories and with some more engaging graphics to demonstrate that these social determinants are in fact important, that if you live in a community that's higher percent of color, your community is less rich in those determinants and also essentially less well performing in health outcomes, both perception of your own health and life expectancy. I didn't add much more to my presentation today because I wanted to make sure I kept to the 5 minutes, but I'm happy at the end to take any questions or comments. When the full model is released, it will be at that website that's at the bottom of the screen. The full team is our goal is January 2021. I think we may have been slowed down a bit by having been working virtually for 8 months, so it might delay a little bit, but we're hoping not. And when the Colorado Equity Compass site is fully developed, it will showcase this model. You'll also have the ability, and we'd be happy to come back and show it once it's done, to then do a drill down to say, okay, here's the high level story. I want to drill down and look specifically at my census tract. And that's where we'll have the comparison of those indicators. We will have some graphics showing when we couple them or group them into what we're calling the buckets. So buckets around health access and food access and housing stability and walkability and environment, that how your particular census tract performs. You'll have the ability to have a look-see at how you perform relative to perhaps the census tract you want to compare yourself to. And then we'll have the ability to overlay the racial ethnic data, the demographics around those populations at the census tract level. So with that, I think I'm probably pretty close to my 5 minutes, and I'll look forward to sharing anything else folks want to talk about when we get to the time to share in the question and answer time.
Thanks so much, Phyllis. I have to say I'm a social determinants of health nerd, so I was really excited by this presentation. We had a quick question for you that we thought we'd offer now. Danny asked, how did you calculate the people of color group? Did you subtract white, non-Hispanic from the total population?
I believe that's what Jen did. I will admit that she did all the data background and I did all the analysis, but I believe, I can get back to you, but I believe that's what she did, that it's white Hispanic versus anyone who, sort of all else.
Thank you.
Great. thank you again for your presentation. We're going to move on to our friends in Atlanta. We have Erik, which I'm not sharing pictures at the moment. We have Erik Woodworth from Neighborhood Nexus, and he's also joined by Sarah Stein from the Atlanta Fed. So I'm sorry you weren't listed on our list earlier, but we're so glad you could join us.
It was a late confirmation.
Can I turn it over to Erik? Great.
Erik, you're muted in case you're talking.
There we go. Trying to unmute. There we go. Sorry about that. I like pulled up my PowerPoint and then the Zoom disappeared. And let's see here. We have
Mystical. I love the scribbles.
Yeah, now, and on top of that, I've lost my, there we go. Okay, so yes, Sarah is joining me. We're gonna probably go really quickly through a lot of stuff here. Let me get this light off my face. So yeah, I'm gonna sort of cover the first part here and sort of show you our eviction tracker. And then Sarah will take over after that and sort of go into some of the things that we found and tracking evictions and so where we're going. Evictions, as we know, are an issue. They are an issue nationally. They're an issue, of course, in the Atlanta region for a variety of reasons. The few of them, of course, are housing instability and that sort of impact on educational outcomes of children, health, stress, the financial tolls of having to move, court fees, the element, particularly in the context of the COVID pandemic, of greater exposure, likelihood of exposure to COVID, being forced out of your home, smaller quarters with family and others if you don't have your own place. So we took this on as an issue in partnership, the Atlanta Regional Commission, the Federal Reserve Bank, and Georgia Tech to get a handle on evictions, particularly eviction filings. And so Sarah is with the Federal Reserve, I'm with the ARC, and we've had a number of other people on our team. The lead from Georgia Tech is Dr. Laura Raymond, so many of you might be familiar with some of her published work. So what we've been doing. So far is we formed this collaborative partnership, particularly around COVID, with an intent of continuing this afterwards. We're currently gathering eviction filing case details from the 5 core counties within the Atlanta metro region. And we're geocoding those so that we can get counts by the census tract and identify sort of spatial patterns and where filings are happening. And then we're working sort of behind the scenes with some regional leaders, legal aid organizations, with address lists, with sort of more granular data to help provide strategic interventions in terms of rental assistance and legal support to those who are being impacted. Right. Very, very quickly, I'm going to go through the dashboard. So this is the dashboard here. It's at, the link is on our slide, but you get this first page here, a lot of information about what we've done. As you can see, there's a current issue with our Fulton County data, but that doesn't keep us from continuing to use the dashboard. We just omit that data. You'll first see a weekly breakdown, and you can, of course, view that by month. This is for the 5 counties. You can narrow down to a specific county and see the change over time. The blue line is our 2019 numbers as a sort of baseline. And then you can go to a map here and look at spatial patterns by month up to the most current full month of data. So we have not yet put in November because the last day of the month was Monday. And we get this data every sort of Sunday. Let's see here. So I'm going to pass this off to Laura, or not Laura, to Sarah Stein to tell us the rest.
Always pleased to be mistaken for Laura Raymond. Hey guys, I'm glad I could make it today. I had some conflicts. I wasn't sure whether they would map out well, but they did. So I'm so happy to meet all of y'all and be able to help Erik share this work. He is the dashboard king of Atlanta. So we're so pleased to be working with him. You can see how beautiful his dashboard is. Okay, so we pulled together this dashboard and people can kind of like click around and see what's going on. The data is, you know, otherwise pretty obscure because it's trapped in court filing databases that are not necessarily easy to navigate or look at like sort of the big picture aggregate level. So that's value that we bring to it in and of itself, but also looking and analyzing kind of what we're seeing and sharing that with area groups like the Atlanta Housing Forum or other organizations, and trying to get that information out there so that people can really understand how things are being impacted, particularly during COVID-19. But as we all know, evictions was a problem long before COVID-19 hit. And in fact, looking at the data, we see that that eviction filings have gone down. Now, of course, it's not the same as evictions. If you think of an eviction as a displacement based on an inability to pay rent, it's simply a discussion of those evictions that have gone through or trying to go through the legal process at the will of the landlord. So the lapse in the federal eviction moratorium and the $600 unemployment supplement in August was evidenced by a 96% higher number of filings across the 5-county region for the first week of September compared to the same week in 2019, which is really interesting because that first week in September was also the week that the CDC moratorium went into effect. So, so that's just very curious. It didn't go into effect, I think, until September 4th. So there could have been sort of like a rush to get in line, but that's something that we found interesting that we can see from the data. We also see that while the filings were relatively low during the initial stages of the lockdown, we've seen that despite the CDC eviction moratorium, filings have been steadily rising. And then, of course, you know, what we also see a need for is an analysis of how different policies and different courts process these eviction filings differently, right? So depending on, I mean, we're just looking at 5 counties in Atlanta, but you can see in the way that courts accept and process and carry on hearings, differences within the 5 counties even. So that's like an important element that is starting to come into relief as we look at these data. And then also, while the CDC issue ban on evictions goes a long way to protect renters from being ejected from their homes for the remainder of the year, it doesn't address any of the accrued missed rent payments, and setting up this sort of sets up conditions for what could be an even bigger wave of evictions coming up. So we're glad to have this in place. Erik mentioned we've got a little bit of a bump in the road with our Fulton County data, which does account for most of the city of Atlanta, but we're working on it and charging ahead with what we have. So that's, I guess, part of the job is just rolling with the punches. Some other things that we've been able to do with the data that we've collected are looking at answer rates. So thinking about, you know, not only who's getting served with an eviction, but who is responding to the eviction. And that's important because if you respond to an eviction, you have the chance for a hearing. It extends the amount of time you have in your home. And especially in a time like this, hearings in many counties are delayed. There's a long list for them. There might be requirements to be held remotely and have consent from both parties or something like that. So the question of responding and an answer can be a very important question as far as, you know, the actual outcome for the individual who's been served with an eviction. So and we can kind of compare those rates across counties and think about legal access, right? The access to legal services, access to the knowledge someone would need in order to effectively file an answer, especially one that has good legal arguments in it. The data can also identify hotspots, so specific properties where filings are particularly high in any given month. That's useful for partner organizations who may want to go to those properties and canvass the residents to try to help them understand how to file CDC affidavits or how to access legal services. So, and we have been working with organizations and people who've been working on those efforts as well. We are also able to take the data and think about it alongside other indicators and data sets, such as the Urban Institute's Emergency Rental Assistance Priority Index, which helps us think through, where are these evictions happening? How do they compare with the vulnerabilities that we know are out there? And how does that change over time? It also helps you think about different policies that are in place and whether they are, having an impact based on, what we might predict. And finally, this is actually something we did with the Emergency Rental Assistance Priority Index. We sort of looked at it in comparison with eviction filings during the COVID-19 phenomenon to think about how we might estimate need in targeting rental assistance in thinking alongside a group that is launching in Atlanta called the Saving Our Atlanta Regional Residents group. And it would be a philanthropically funded rental assistance group. And, it's basically building the plane right now to hopefully be able to provide assistance, especially once that CDC moratorium expires, if it's not extended January 1st. So that's a quick run through of what we've been up to. I'm sure there are plenty of questions, a lot that we didn't go into or share, but thanks for listening.
Thanks, Sarah. Yeah, there's a lot. We have a lot. We could be talking Q&A here now. Right.
Yes, we will have Sonia do her last presentation, and then we'll move to Q&A for all of the presentations. Sonia, are you ready to share your screen?
I am. Can I go ahead? Okay, let's do this. Okay, can everyone see my screen and hear me okay? Great, so I'll get started. Good afternoon, everyone. My name is Sonia, and I'm an URA here at the Metropolitan Housing and Community Center with the Urban Institute, and I work with Kathy, Camille, and Rob on the national NNIP. We're all here for NNIP. I'm currently here in Houston, and I use she, they pronouns. I'm excited to be here with you today to give a quick update on the NNIP data inventory and the SNP scores that we calculated for everyone. So first, I want to say a big thank you to responding to all of our messages and updating your inventory so that we have up-to-date information, especially in this wild year. That's a big accomplishment. Just to give everyone a refresher of why we do this at all, it's because local data is central and essential to the mission of NNIP. When we say local data, what we mean is something pretty specific. So basically, it means that data is available, one, at a small geography, the smaller the better, such as tract, block, GRP, SIP, or parcel. It also means that it's getting updated in a recurring basis and that it's up to date. And every year it comes in and every year it is fresh. So the reason why we do a data inventory is both for you and also for us. For partners, it's a chance to self-assess, to reflect back on the data that you have, the data that you would like to have, and to think about how you could use the data you have in your work. For our wider network, it can help us improve and strengthen us. So when cross-site opportunities come up, it is very easy for us to go to the website, look at the inventory, and identify organizations that could be good partners based on the data that they already have. So I want to reiterate our thanks and gratitude to all of our partners who turned in their data inventory updates despite everything going on. It really does benefit our work as a network, especially in times like these. So thank you again. Skip the slide 1 second. Can I go back? Yes, I can. So now I'm gonna go through what SNP stands for. It stands for Small Geography Neighborhood Indicator Performance. It's a score out of 10, and the 10 components are displayed here on the slides. A little bit of background for those of you who aren't familiar, we decided a few years ago in conversation with the executive committee that these indicators are kind of a little bit representative of the broad spectrum of data that our partners might have available and that we might want to track. So every time you fill out your data inventory, you can upload data in these categories, and then you get your SNP score, which we calculate. Oh no, why do I keep doing that? Sorry, everyone. Bear with me. So this slide kind of shows the methodology in a little bit more detail. If you have data in-house at a small geography, it's current, it's recent, meaning it's one of the years that is represented on this slide, then you get a point towards your SNP score, and then we add all of those up together. This slide, I wanted to show you how we all added them up and how the network is doing. So this chart shows the distribution of every organization's scores. We have our top scoring organization with a score of 9, which we will recognize shortly. And we have a pretty linear distribution. Average score was about 3.7, which is a little bit lower than our 5.3 last year, but that's okay. Then this slide here shows us that not all the data are equally common within that SNP score. So within each of those areas that I mentioned, we have a lot of different indicators that you could report. And school and business data was the most commonly reported, while child and adult health is the lowest. We typically, that's kind of in line with previous years, that public data is a little bit less common with our partners, but maybe this year could be a little bit, this upcoming year could be a little bit different, given that there has been kind of a renewed interest in public health data this year due to the pandemic. Just so that you know, some of the indicators that are included in those public health kind of buckets include immunizations, ER visits, child blood lead levels, and deaths by cause. So this next slide spotlights the crime and safety bucket, one of the 4 out of the 10 areas that were expanded with new indicators last year. The new additions were made by asking our network partners about what they might use or what data would be relevant in their ongoing work and that would be useful in tracking. The new additions made last year included prison population, specifically in the crime and safety area, prison population, jail population, bail, charging decisions, sentencing, complaints about police conduct, police pedestrian stops, police use of force, and police use of vehicles, which you see some of those reflected in this chart here. The graph shows you that some people have successfully started reporting these new data, which is really exciting, such as police use of force and bail. And an opportunity for growth next year could be more reporting of prison population, jail population, sentencing, and complaints about police conduct. Although I admit that it's really difficult to get these data and to access these data, which is why this can just maybe be a point of reflection for us next year as we think about those really interesting data sources and indicators that can be a little bit harder to access. So Data-Driven Detroit got our highest score. Congratulations. I'm super proud of y'all. Thank you for doing the data inventory. All of your hard work this crazy year and continuing to make this initiative a success so we can keep collecting data next year. As a newer person, it was really impressive to see how long we've been collecting these data and how rigorous and routinely we make sure to update and keep our data fresh. And that's really cool because I believe in local data. So thank you for that. And just a quick note that we weren't able to send each of you your individual SNP scores yet, but we will be doing that as well as uploading the general report to the website sometime after this call. So you can review it and look at more details that I didn't get a chance to review in my 5 minutes. So thanks, everyone.
Great. Thank you so much, Sonia. We are going to use the rest of the time to answer some questions. Erik and Sarah are both available to stay on after the call as well. So feel free to put questions in the chat and we can stick around if there's additional questions for those two. We had some in the chat and I saw Erik was answering some about the language used, but also there was a question about, are you expected a certain % of evictions per number of filings?
Sarah could, I think, probably a better person to answer that one.
Sure. So, so I'm assuming that the use of the word eviction in the question means an actual like kicking out or displacement ordered by the court. And I think like we have not, so for one thing, that has not been very frequent, just generally, and it is something that we could look at historic data to kind of get a better picture into. And we do have it's called event code data for, I think all of the counties. So each county, it's important to know, has like a different portal that you go to. And some of them are the same, you know, kind of interface and company, but, you know, slightly different still. And then others are different interfaces and different providers. So even just getting the data from each one was a challenge in and of itself that we had to surmount. But we will be analyzing more of the different event codes. You know, I don't want to get like too far in the nitty gritty, but it requires a lot of coding in this and really deeply understanding what the event codes mean and to make sure that you are putting the correct interpretation on the outcome. And I was a housing lawyer before I became a researcher at the Fed. I practiced at Legal Aid for 5 years. But then, you know, there are other housing lawyers who are actively practicing, showing up for these hearings, you know, knowing what's going on, and we're in consultation with them to make sure that our coding for, you know, for the various outcomes is accurate, and so that we could do those sorts of expectations or predictions or even just descriptive analysis.
Yeah, and also to sort of to follow up on what Sarah said, right? There's formal and informal evictions, right? And so if we were to sort of put a number out to say, oh, this is the number of evictions, it would be highly caveated by these are the number of formal evictions that we could determine based on the case information. And we know many cases that evictions happen, cases not being resolved. Simply the filing of the case leads to an ejection. And so, yeah, that's where we are in terms of monitoring them. There's some estimates out there. And I guess also too, with this group, it would be nice to know if there are others who have had success in sort of coming up with good. I know San Francisco, I know on the West Coast in particular, there's organizations that have been tackling this for years and having some idea of a good method because we are working through that at the moment.
I see a couple questions for me and Danny. We have a 4 o'clock meeting. Danny, you want me to take the questions and you'll go to our 4 o'clock?
Sounds good. I was about to message you with that idea.
Okay, yeah. So
also, if you need to go, Amy, I can
me.
talk to you later.
That's okay. No, I can talk. Actually, our meeting is about our violence dashboard. So we have a community violence working group that was funded through UHC and led by UHC. Our colleagues, John Rich and Ted Corbin, who are, you know, are leaders in this field. And we have a mix of community and city leaders and some state leadership who are doing community violence work. We started this work before all the racial justice and police brutality, you know, additional attention, which was already a part of the work, but it's given us some new opportunities. So we produced a few things. We've been looking at firearm-related violent incidents in the city before, during, and after COVID. We've produced that not in a dashboard, just in a line graph to, you know, stimulate conversations about ways to use data. We've also produced maps of police fatalities, you know, police violence that ended in fatalities, and map that over tracts in the city that have more than 50% minority residents, and show that the very vast majority of them happen in minority neighborhoods. So we're using these data right now with our violence working group to figure out the best ways to communicate these data through dashboards. Some of them are geographic, some of them are a bit more temporal. And we have colleagues in the Department of Public Health who collect, you know, violence data, and a new dashboard through our DA's office, who we're working with to kind of make that a little bit more exciting. So that's one of the ways that this has led to other people have liked the dashboard, want to talk about other things that we can put into it because they see the utility, and we can talk another time maybe. I don't know if people want to hear some of the things we've done with it. But from everything from like, local principals to, city agencies and CHOP using our dashboard for some of their own work.
Great, thank you.
So I did have the other question out there, Amy, and I can follow up with you in a later conversation, but I would love to hear more about how people are using your COVID vulnerability information. You mentioned that it's being used by some of your stakeholders.
Yeah, so what I would love to talk to you guys about is that we've been talking with our Department of Public Health about mapping disruptions to city service utilization, and receipt kind of data, services and benefits. And Phyllis is still on. So Phyllis, if you want to jump in, please do as well. We would love to be able to show over time and over the months of the pandemic, through the spikes and through the restrictions and relaxing of restrictions, what's happening to delivery of behavioral health services, homelessness services, and things like that. They have a CDC requirement, as all cities do, to actually track disruptions. And I was curious if anyone has found a way to map those, to display them in their own dashboards. We would love to use that as a use case in talking to our city champions who, there's just a bit of challenge with some seeing the utility of seeing data visualized in this way, and others thinking that it's not as important, and then being kind of fighting internally, and that affecting our ability to, use some of these data in this new way. It's funny to us how some of our city systems are very well set up for requesting data for research, but not for supervision or advocacy. So we're kind of back in that challenge I know we've talked about with you guys before.
Mm-hmm.
I have a question for Phyllis, if you have a minute, if you don't need to jump off. Just on the, we are grantees of Robert Wood Johnson Foundation, and obviously our first social determinants of health presentation was about 10 years ago by Amy. Thank you.
Thank you so much.
And do you think that we still need to sell it? Do you know what I mean? Like, do people not get social determinants of health after all this time? I don't know what do you think the pushback is?
I have the same question as you.
I mean, we live in a bubble often, so I don't get to see.
It seems pretty intuitive to me, but as I mentioned, this project, was originally funded from the trust to the Pettit Foundation when Jen was at Pettit. I will admit it started probably like 3 or 4 years ago, so that whole notion of hearts and minds was maybe more important back then. But they've stuck with that. That is still sort of front and center to what they want to do. I came to this late, and I came to it to sort of be the analytic piece. I wasn't involved in all the early on conversations, but just sort of hypothesizing where they may be coming from. We have a fairly big disparity in Colorado. We often say we're 5 states. And so people think of the Denver metro, which is fairly urbanized and, very urbanized and highly educated and probably aware of some of these issues. And then we have some areas that are still struggling, both economically and from a health perspective. And so they may be thinking of the more rural areas of the state, the areas that I call sort of are like corridors of despair, areas that really never recovered from the previous recession and now are getting substantially hurt again. And maybe what they have in mind is to get into those communities and really try and convince leaders that there needs to be investment in these areas. That's kind of what I think. I think in the urban areas, people are fairly well aware. I'm not saying that
things are great.
Responses are appropriate, but so yeah, I'd be with you. I can run that by Jen too and ask.
No, I was just
what
curious.
the early conversations were, but I was kind of surprised to hear it come up as much as it did. I thought that the focus would be, and it is largely on the racial ethnic, but this change hearts and minds comes up all the time in our conversations with them.
Yeah.
It definitely came up in a couple of projects of Kathy and I, this like change heart and minds being the pivotal piece of some of this work.
Yeah, although I have, anyway, there's also pushback that, right, when the rubber hits the road, we need to do something differently.
We need to do something, and people need to be invested.
And change the right. Chicken and an egg. I think that's great. Thanks, Jay. I see your note too, and I think maybe it is about pushing back from the healthcare side and trying to improve the collaboration between the two and the money interests that are involved. Great. Well, thank you very much. I think we got to all the questions, or most of them, but feel free to reach out to us and the presenters if we missed yours. And Camille will send out the recording and slides afterwards to everyone. And we appreciate you spending your afternoon with us. Thank you very much to all the presenters. It's exciting to see all the work. Anything else, Camille? I think we can just wrap up.
That's great. I'll send out links and the recording. And thank you all so much for joining us and staying after for some more discussion.
Thank you.
All right,
Bye. It was nice to meet you guys.